Hello, today we're going to talk about bag technique. We're going to talk about the different types of bags that you may choose. We're going to talk about supplies that go into the bag, the actual procedure itself, and then lastly we're going to talk about deficiencies and what we typically see during site visits by the surveyor with breaks in the bag technique. First, we're going to talk about the policy. Each one of you have a policy that outlines bag technique. You'll find it in your number 2 policies, which is your patient care policies. The bag technique policy is designed to, number 1, prevent infections in the home. Also to prevent the spread of infections, either infections that you may take into the home or infections that you may bring out of the home to other patients or to your car. Rolling bags are not acceptable under any circumstances. They will cause contamination either being brought into the patient's house or into your car or both. We're also going to talk about what does your staff take into the home in the bag and who provides those supplies. This is a picture of a bag. It comes from Hopkins Medical. The price on it's about $30. The policy you have does not box you into a specific type of bag, so you can choose whatever will work the best for you. But as we work through the procedure and you see the steps, you'll realize the most important thing about the bag is to make sure that we have at least 2 to 3 compartments, one for clean equipment, one for dirty equipment, and then some outside pouches or pockets for either hand washing supplies, barriers, and then also possibly a sharps container. This bag does have 2 small outside that you can see on the right and left hand side of the bag for a sharps container, which is convenient as well. Some of the common supplies that we see in the bag, first of all, are bag barriers. You want to pick something that's moisture proof on one side. Acceptable barriers that are inexpensive might be medium garbage bags that you get at the dollar store, Walmart, grocery store. Also possibly wax paper, and then parchment paper is acceptable. Newspapers are not acceptable, so don't use newspapers. Some of the websites, if you go on and Google bag barriers, they'll want to sell you expensive bag barriers. Don't feel like you need to purchase those, because the bag barrier at the end of each patient visit is going to be thrown in the garbage, so it's not something you're going to be able to reuse. Hand washing materials for the bag is going to include liquid antibacterial soap like Dial or any of those, paper towels, and an alcohol-based hand gel like a Purell. The antibacterial wipes such as Lysol or Clorox, those are going to be used to wipe down the equipment after it's used or touched the patient. And that would include a blood pressure cuff, a stethoscope, a thermometer, possibly a pulse ox, something, any of those types of pieces of equipment that you would use to assess the patient. Also, non-latex clean gloves. You want to make sure they're non-latex, that they're vinyl. A lot of patients and even caregivers have latex allergies, so make sure you get vinyl gloves. A small sharps container, and then lastly, the nurses may have some basic wound care supplies, such as gauze, tape, saline, any of those types of things that they would routinely maybe use during a visit. One of the things that a lot of the nurses will bring their own blood pressure cuff, stethoscope, but the other supplies for the most part, unless they have their own bag that they want to use, the agency is going to be responsible for supplying that for the employee to use. We're going to go over the steps of hand washing and bag techniques real quickly, and then I'm going to actually demonstrate bag technique for you. So when you enter into the home, the bag's going to be on your shoulder. Again, no rolling bags. You're going to place the barrier on a hard, non-porous surface. It should be like a table or a countertop. It could be in a hard chair, but it's not recommended that you put it on a couch or the bed, anything that could be damp. Once you put the barrier down, you're going to place your bag in the center of the barrier. So you want to make sure the barrier is large enough that you have some space on each side of the bag for a clean and a dirty area. The hand washing supply should be taken out of the bag. That's going to be the paper towels and the liquid hand soap. And then the hand washing is preferred to be done in the bathroom. If you can't go into the bathroom to do hand washing, or if there's no running water in the house, or the house is a hoarder or bug infested, then you may opt to use the gel for hand washing. The one thing you want to make sure though, if the patient has C. difficile or MRSA infections, then you're going to have to make accommodations to do soap and water washing of your hands. Once the hand washing is done and you come back to where your bag is, you're going to start taking out all of the clean supplies and equipment that you're going to be using to take care of the patient. And all those items will go on the clean side of the barrier, and then once you take those out, you're going to close the bag. So that includes your stethoscope, blood pressure cuff, thermometer, so forth. As you use those supplies or equipment on the patient and they touch the patient, then they're going to be put on the dirty side of the bag. Once you're done taking care of the patient and you've used all your equipment, then you're going to wash your hands with gel, and you're going to clean each piece of equipment with a wipe and return it to the clean side of the bag and close the bag. Make sure that you use a clean new wipe for every piece of equipment. Otherwise, you could possibly be cross-contaminating that equipment if you're using the same wipe. Once all of your equipment is back in your bag and you close up the bag, then you're going to perform the hand hygiene. And then you're going to put the bag on your shoulder and go out. The one note I do want to say here is that if you're using a laptop or some type of device in the patient's home and you're touching it in between the patient, you want to make sure that that piece of equipment is clean too with a barrier or a wipe. So you want to make sure that whatever you use is not going to harm that laptop or handheld device. But again, that's going to be considered equipment and you'll need to clean it. Okay, so we're ready now to execute the bag technique. We come into the home, we have our bag on our shoulder. If you're going into a home where there's no place to lay your barrier down and create your bag barrier clean and dirty, then you may want to consider hanging your bag either on the back of a chair or a doorknob. Never on the ground. Even if you put a bag barrier down, that will be a deficiency. We'll talk about that. So I've identified a clean surface where I'm going to put my bag down, and I'm going to get on the back side of my bag, I'm going to get my barrier. Now we talked about different types of barriers. This is parchment paper that I've used. Again, it's acceptable to put that down. And when I put it down, I've got a piece large enough that I can put my bag in the center of the barrier. So I've created a clean side and a dirty side for my supplies. On the outside of my bag, I'm going to take out my paper towels and my antibacterial soap to use for my hand washing. Go into the bathroom, I'm going to do hand washing, and I'm going to come back to the bag. Now make sure that when the nurse goes in and washes her hand on the way back to the bag, that they don't touch the doorknob, they don't pet the dog, they don't touch anything in the house till they get back to their bag. They want to make sure their hands are clean. In the event that they do touch something and they feel like their hands are contaminated, that's the time when they could use the hand gel and re-sanitize the hand. Once that's done, then I'm ready to take out my clean supplies out of my bag to start to see the patient. So I'm going to take out a stethoscope, a blood pressure cuff, a thermometer. If I felt like the patient, I needed to use gloves, and I could take out gloves as well. Once you've taken everything out that you're going to use for the visit, you want to close that clean side of your bag. If for some reason you need to go back into that clean side because you forgot to get something out of there, let's say gloves or a pulse ox machine or whatever, you're gonna need to re-sanitize with your gel your hands. Don't go back in after you touch the patient to get back something in that clean, because then you've contaminated that whole section of the bag. Once I've used all my equipment for my patient, as I use it, I'm gonna be putting it on the dirty side of my bag. So all of this will be transferred to the dirty side. Once I've completed my patient visit, then I'm going to gel my hands again, and I'm gonna get on the outside of my bag, I'm gonna get my wipes. And remember, I'm gonna use one wipe for each piece of equipment. And I'm gonna wipe it off, discard this, it can go in the regular garbage. And I'm gonna put the clean items as I wash them back in there, into my bag, into the clean side. So I'm gonna wipe everything down, the blood pressure cuff, all of that's gonna get wiped, wipes thrown away. And I get another clean one for each piece that I'm gonna wipe down very thoroughly. Again, remember, if you've got a laptop, that's gonna need to be wiped down too and put in before it's left at home. All of the wipes get thrown away. I'm gonna hand sanitize my hands again, close my bag. I'm gonna put my bag on my shoulder. The barrier and the wipes are all thrown away in the garbage, in the patient's garbage. Deficiency that we see during the bag or the site visits. Number one is a bag barrier that's not used or it's used improperly. We get deficiencies where bags are placed on the floor. Even with a barrier, that's gonna be a deficiency. We see paper towels not being used to turn off the water after their hands have been cleaned. That's a contamination. Frequently the bag will be left open and the nurse or the caregiver will leave the room. And leaving the bag unattended, something could get into the bag or the patient could get into the bag, and anything that goes into that clean side is then considered that whole section as contaminated. We talked about entering the clean side of the bag with dirty hands, meaning that you touched the patient and you went back into the clean side without washing your hands. And then the last one we frequently see is not cleaning the supplies correctly. Whether that's using the same wipe more than once, or not cleaning at all, or forgetting to clean something that's touched the patient and it's put back into the bag. Probably the best thing that we can tell you, other than watching the video and understanding the policy, is practicing bag technique. Number one is part of your orientation. And then as you get ready to start seeing patients, the nurses should be doing some role playing with hand washing the bag technique and making sure they're doing that with every visit. So that when it comes time to the survey, it's gonna be just natural for them to do that. And it's not gonna seem to the surveyor that they're only doing it for the survey. They will know that, and you could possibly get a deficiency.